Today's lecture is about a parasite named Trichuris trichuria. Trichuris means hair and trichura means tail. So this is a parasite having hair-like tail. Nickname of this parasite is whipworm. This was first studied by Linnaeus in 1771. This parasite is worldwide in distribution but very common in tropics. Infection of this parasite is very frequent, but disease due to this parasite is very rare to observe. Habitat: in man, it resides in wall of cecum and appendix. Some of its life cycle it does in the soil also. It spends some of the life cycle in soil, where it converts into rhabditiform larva, and this rhabditiform larva is the infective stage. Now about the life cycle and the morphology. This parasite has a male worm and a female worm, and as usual the male worm is smaller than the female worm, and this part is whip-like, as its name goes, whip-like organism. Like this. Inside this coil is present the intestine, means this is a posterior part, and we can see intestine and the reproductive organs in this posterior part, and this whip-like structure is the anterior part. This is the male worm. This male worm has the coils in the posterior part, and the female, it doesn't have the coil, it has spindle-like end and anterior end whip-like, and is more longer than the male worm. This is the capillary esophagus embedded in the mucosa. This is the female worm. This structure, the coil structure that I have made, this is the capillary esophagus in mucosa. Okay. Here the anterior part of this parasite has whip-like structure. This is the anterior part, and the posterior part of both male and the female parasite. The posterior part, we can see the presence of intestine and reproductive organs. The lifespan of this male and female parasite is up to 5 to 10 years. The life cycle starts when the male worm fertilizes the female worm, and this female worm becomes gravid. Once it becomes gravid, it can lay up to 5,000 eggs per day. And this egg is having pole-like structure, 2 poles, and is having a dumbbell shape middle, and these are the 2 pole plugs. We call it as a pole plugs. And this egg is having 3 layers. This was the outer layer, this is the middle layer, and an interior layer. These are the 3 layers of the egg, and inside this layer is present the unsegmented ovum. This is the third layer. And this is the ovum. And this ovum contains unfertilized eggs. Okay. Now this is the egg that is laid by the female once it gets fertilized. These are the 3 layers: outer layer, middle layer, and the interior layer, and inside which is present unsegmented ova. These are the 2 mucus plug at the poles. These are the 2 poles. In these 2 poles, mucus plug is present. Now whenever this is the egg that is produced by the female, gravid female. This is having 3 layers: outer layer, middle layer, and inner layer, and then inside this is present the unsegmented ova. This egg is having 2 plugs known as mucus plug at the 2 poles. The life cycle starts whenever the female becomes gravid. It will lay egg. These eggs are shed off with the feces and it reaches soil. The kind of the soil that this parasite utilizes or prefers are the warm, moist, and shady. Under these conditions, inside the soil, within 3 to 4 weeks, this egg converts into rhabditiform larva. This rhabditiform larva again is dumbbell shape, having the 2 mucus plug, and this will show 3 layers. This is second layer, this is third layer, and the ovum. Previously it was unsegmented ovum. Now inside the ovum we can see developing larva from the unsegmented ovum. This rhabditiform larva having 3 eggshells and a small larva inside is the infective stage of Trichuris trichuira. This type of larva, if it happens to mix with food and water and makes it contaminated, and if any host takes food, water or any intables that is having rhabditiform larva, that is the infective stage of Trichuris trichuira, it is swallowed and it reaches small intestine. In the small intestine, this larva hatches out from the plug. This is the larva. These are the 3 layers, and this was the larva. This larva comes out through the plug like this, and it becomes free larva that can migrate. Okay, this happens in the small intestine. This larva that hatches out, it sticks to the cecum by its sticky layer. This sticky layer, there it rests for 2 to 3 months, and in the cecum, if this is the, suppose this is the layer of the cecum, this parasite embedded its whip-like structure inside the wall of the cecum, and its posterior structure, that is having the esophagus, capillary esophagus and internal organs, that remain outside the wall of the intestine, and the whip-like structure is embedded inside the wall. This pierces mucosal wall of cecum, and there it rests till it becomes gravid. Once it becomes gravid, then again fertilization will take place. Egg will be produced. The 3-layer egg having the 2 plugs, unsegmented ova. This will be shed off with the feces. It will reach soil in warm, moist and shady environment. This egg will develop into rhabditiform larva. This rhabditiform larva, if it contaminates food and water, it goes inside the host through swallowing, reaches a small intestine. In small intestine, this larva hatches out through the plug. It comes out, hatches out, sticks to the wall of the cecum, where it penetrates its whip-like structure or the posterior end inside the mucosal wall, and the anterior end and the posterior end having the esophagus is still outside. You can see it outside the wall. It rests there till it becomes sexually mature into male and female worm. Now about the pathogenesis. Pathogenesis of Trichuris trichuira, as we have already mentioned, that infection is very common, but the disease due to this Trichuris is very rare to be seen. So first thing that we'll write here is it is asymptomatic until load of worm is very heavy. If the load of worm is very heavy, then only the patient shows symptoms, or patient may come to a physician or a doctor with some complaints or symptoms. Otherwise, the patient is asymptomatic. The majority of the pathogenesis is due to mechanical effect of the parasite that is living inside the cecum and the appendix, and also due to the allergic substances that the parasite secretes during its lifespan. When the parasite pierces into the intestinal mucosa, oozing of blood occurs. The blood oozes out. When the blood oozes out, the patient suffers from blood loss, and this parasite takes about 0.005 ml per worm per day. Means one worm will take 0.005, and if the load is heavy, you can see how much of blood loss will be there. These kind of patient may suffer from anemia and malnutrition. Another pathogenesis, because of the presence of the adult worm, it may cause mechanical blockage of lumen where it resides, and also of appendix where it resides, and it may be causative agent of acute appendicitis. This parasite also causes mucus diarrhea because it is disturbing the intestinal wall. The patient may suffer from chronic dysentery and abdominal pain. In young children, rectal prolapse is seen. This is seen in young children. However, in young children, oozing of blood, blood loss, everything will be seen. Anemia, malnutrition, mechanical blockage, everything will be seen. Other than that, we can see the rectal prolapse, where the lab diagnosis includes these. In rectal prolapse, the sphincter muscle of the rectus, that they are effective. In lab diagnosis, we can detect eggs in stool. If the egg is less than 10 eggs per smear, we can say it is light infection. But if it is more than or equal to 50 eggs per smear of the stool that we will be making, it is heavy infection. If 10 eggs per smear, it denotes light infection. More than 50 or 50 eggs per smear, it is heavy infection. We can also call for proctoscopy. We can also see Charcot Leiden, Leyden, Leiden crystals in stool. Charcot Leiden crystals in stool. Drug of choice or the treatment part includes albendazole. Prophylaxis includes Supermost is hygiene, to maintain hygiene, cleanliness, proper disposal of feces, washing of fruits and vegetables, and we should not shed off the feces, and health education. If these fruits and vegetables should be washed, because many of them carry them, they may touch them, or it may be grown in a polluted field. So before consuming fruits and vegetables, it should be washed, and health education is the utmost important. This is all about Trichuris, Trichura. Thank you.